Now, speaking of men and men having facelifts, Dr. Brahme, you have a lot of male patients. And how are men different? How is their anatomy different than a woman? And what are the things a man needs to look for when they're looking into doing a facial rejuvenation?
First of all, men have bigger faces, much bigger faces. I mean, probably 30% bigger than women. So, and men have more hypertension, they bleed more, they swell more, they bruise more. So the recovery is a little bit longer for a man, but not much. You just basically have to look at the hair growth and see where you put the incisions, because men are going to, in some cases, lose some hair, male pattern baldness. And so you don't want to put scars up in the hairline up here, because eventually that may be visible. So you have to settle in for a longer operation. Male facelifts usually take 4.5 hours. But anatomically, their structures are thicker. They hold sutures better. So they have a really, really good results. But men also don't want to look different. You have to be very careful not to feminize men. For example, lifting the lip because the lip has grown long is a very feminizing procedure. And so I really don't do that much in men unless it's very blatant. In terms of fat grafting, you want to put the fat in a little different anatomic position than you do in women. But men lose fat as well. So you have to not be overly enthusiastic about removing fat and more judicious about putting fat back in. Anatomically, we all have the same nerves. We all have the same skin. We all have the same structures. It's just some considerations in men that you really want to be cognizant of and talk to your patients about it. Especially shaving, for example. When you tighten the neck, you may find yourself shaving behind the ear a little bit. So you may want to do laser hair removal just to cure that problem.